Welcome to Healthcare by the Numbers, a podcast that uncovers what's driving healthcare transformation. Join us each episode as Caravan Health leaders interview the brightest minds inspiring healthcare innovation and discuss the numbers which have shaped their thinking. Welcome, everyone. I'm your host, Todd Searls, Vice President for Business Development at Caravan Health, and this is Healthcare by the Numbers, a podcast that explores the numbers driving change throughout our industry. To learn more about Caravan Health, this podcast, and to check out episodes of the show, visit caravanhealth.com. Be sure to sign up for our newsletter to get notified of future episodes. You can also visit our program page on Healthcare Now Radio, follow us on Twitter, LinkedIn, and Facebook under our username @CaravanHealth. Today, we're talking about healthcare costs, which is anyone who's familiar with Caravan Health, this is at the heart of what we do. Our company specializes in helping community health systems to transform their care delivery, to save money, to improve quality of care through accountable care. And so we are delighted to welcome Dan Weissman, the host of Arm and a Leg podcast, which digs into all aspects of the cost of healthcare, and with a special focus on the impact to us as consumers and as patients. Welcome to the podcast, Dan.
Thanks, Todd. Great to be here.
You betcha. I've listened to your podcast. Cool. I am absolutely enamored with your take on looking at, the industry as a whole, what we as patients can do to become better educated. But for those listeners who are not yet familiar with Dan and his podcast or your work before that, you've had a long career as a radio journalist. You started back, years ago, we'll say, and have worked in places such as Marketplace and Planet Money. And then just recently in 2018, you started a very successful, something I think is often actionable, definitely humorous, while also sobering, the Arm and a Leg podcast. And it delves into the spiraling cost of healthcare and its impact on everyday Americans. I think your show does a really good job of highlighting and seeking answers that solve the very common struggles that you and I and everyone else experience as patients within our healthcare system. I know that you're often joined by some of the biggest names in healthcare policy, but I do love the fact that based on one show, it seems to be almost a waterfall effect where you'll get comments from some of your visitors and listeners who are hidden experts, and you bring them onto the show to spotlight that experience and their knowledge in order to continue to help others. So I want to thank you again, Dan. I really do enjoy your work. And so I'm looking forward to this few minutes that we have together. You had a great career, I think, as a radio journalist, and perhaps you can give our audience just a little bit more background as to how you came, to the Arm and a Leg podcast from having worked, in Marketplace and Planet Money and things like that.
Well, thank you so much for saying such nice things about the show. I really, really appreciate it. And yeah, I think I'm still essentially a radio journalist, and I still do stories for NPR on topics like this, and everything I do kind of comes out of the tradition of journalism and public radio journalism, especially. I ended up doing this because this is partly, number one, this is an issue for my own family. For one thing, my wife and I both made major career decisions because of health insurance, not just like changing jobs, but big career shifts. And also, as a reporter, it's been really clear to me for a long time, right? This is, it's kind of an enormously important story. It's not like I'm alone in structuring my life around the cost of healthcare. I don't even have it especially rough. And B, these stories they're really relatable and intimate. Like, they're stories about our bodies and our bank accounts. It doesn't get any more personal than that. And they raise questions about the very biggest ways our society is organized, like public policy and politics and economics. And there's this level of nerdy complexity, science and medicine and business structures, which appeals to me. So this idea of exploring all these questions at once, like why does it cost so much? Why is it such a mess? It speaks to all these things I'm drawn to. It's important. It affects everybody. Intimate stories, nerdy complexity, professionally. And because it's tied to me personally, I'm like, yes, let's do this. And it also seemed to me that starting a show about it made sense because there hasn't been, I think, a kind of sustained conversation for non-specialists in traditional media outlets. Like, in the course of just reading the news, we usually come across like three types of stories, like individual outrages or tragedies, which, could be like, well, this thing happened to this person, or this hospital or clinic was doing this horrible thing. That's one. There's also political horse race stories. Oh, will the Biden administration do this? How will Republicans respond? And kind of like business page stories that sneak into our Twitter feeds of like, CVS is buying this other company. And I think as lay people, we're like, that sounds like it could affect me, but I just have no idea how. Like, what does it mean? And all of these stories, from most of us, just raise a lot of questions about what is going on. And because of the way, news media is structured, that's all that kind of ongoing conversation doesn't happen so much. But that ongoing conversation seemed to me like it would be important for any of us, including me, if we were going to come close to any answers. And the other thing that became clear to me as I was starting to think about how to do the project was it's really got to be more entertaining and empowering and useful than enraging and terrifying and depressing, because we all have a lot to deal with. And if it's a podcast, you're not just coming across it, in the course of watching 60 Minutes or listening to All Things Considered or whatever. You're going to have to choose it. And so that's been an intention so far. Does that answer the question of how
it does. It absolutely does. I think, that's one of the things that draws, I think, people to not only your podcast, but the whole topic of healthcare, where we are today in America. Every day Americans face sometimes the life and death decision of, do I pay for my utilities, right? It's an often used expression, or do I pay for my medicine, or do I get food? And one of the things we'll spotlight here in a second, as part of our numbers segment, is, the spiraling amount of medical debt, which forces families to undergo bankruptcy, right? As part of just wanting to get healthy from a disease or a condition that, in the way our healthcare is set up, it'll bankrupt them. I mean, myself, to your point, right? So I'm very keen on these, on the numbers, as it were. My own family, actually, my parents had to go through a medical bankruptcy.
Oh, Jesus,
which is, I mean, it's ridiculous to think about, right? One of the most, what can we say? Historic, overall time, successful experiments in democracy in a country. And here we are with a huge debt burden amongst every single American, because of the cost of just keeping ourselves healthy and alive. And it is something, I think it touches on the intrinsic need to care for one another's. And so that's why I'm excited that you did go down this path and give that space and that voice to people to be able to express themselves. I think, to kind of highlight just how bad it is. We like to spotlight inside of the Healthcare by the Numbers podcast, some numbers. And as we've just talked about, we spend an enormous amount on healthcare in the US, totaling $3.8 trillion in 2019, which for everyday Americans is about $11,500 out of their pocket every single year for office visits, minor and major procedures, premium payments, and things like that. That's 17.7% of our entire economy. And yet, when we look at the next closest country, it's Switzerland, spending 12% of their GDP. And you have to ask yourselves, I mean, the numbers are staggering. What are we buying in the healthcare space that perhaps is making us healthier for that amount of money compared to, say, Switzerland or some other large, first world country? And I think as we look again year over year, just like in the past, the amount of healthcare spend just keeps going up. We keep aging, which is a good thing, right? We don't want the alternative. But the rise in expenses has affected the American household. I mean, nearly 20% of American households have been sent to collections over medical debt. And just like my family, nearly 10% declaring bankruptcy at some point just because the debt burden was too high. So, and there is no worse, I think, testament to this than the fact that 1/3 of GoFundMe crowdsourcing is for healthcare expenses. I mean, that has become one of the largest insurers, if you want to call it that, across America, with 40% of our households not even being able to handle a $400 unexpected medical bill. So I think you touch on it perfectly. It is very personal. It touches on the two things you don't want most people to know about: how much money's in your bank account and, what's going on inside of our skin, right? So, those are the numbers. I mean, when you sit back and look at all the stories that you've shared, what has stood out to you, not only about these numbers, but about those stories and at the end of this day, we'll hopefully end on an optimistic note, but what has led you from these stories to perhaps solutions and everything in between?
I mean, well, these numbers are horrifying, right? And that question of like, what do we get for the extra increment of GDP that we spend? I mean, there's tons of evidence that like, it's not working out for us, right? Like our outcomes in terms of how healthy we are, how long we live, maternal mortality rates, all kinds of things we don't compare so favorably to places that spend less as a portion of their entire national wealth on healthcare. And there's lots of evidence. And, one number that I've seen compared with that number of like $11,500 for every person spent on the healthcare system is we spend about $56 a person on public health every year. Right. So, that's a problem.
Yeah.
So, gosh.
Yeah. It's frustrating. It makes you, what do they say? Verklempt.
Yes, that's a good word. That's a good word. Yeah, no, it's frustrating. It can be overwhelming. One thing that's happened as I've been doing the show for longer is, when I started, I thought like, oh, there's all this interesting nerdy complexity and stories. This will be like a kind of ticked off Planet Money, but for healthcare. And and there is a lot of that to explore. But after the first couple of seasons, we said, my collaborators and I were like, we should start focusing on self-defense. Like, what can we do in the here and now to protect ourselves from all these things that can come for us? Because, as I put it at the time, the cavalry's not coming. We made this turn in 2019. So at that point, the 2020 presidential election was a good ways away. And I was like, if your dream candidate, whoever that might be, were to win a landslide victory with a giant legislative wave behind them to enact and we're dedicated to enacting your dream legislation. Well, that was, 2019. Like, the inauguration was still a year and a half away, and it takes time to pass legislation and to implement it. I mean, you were still looking at years before you'd see your dreams come true. And with conditions like we have, where, again, as you say, 40% of people can't handle a $400 unexpected medical bill. And that's, $400 is like, the ante for a medical bill usually. So, that meant that we're all in danger, or just many of us are in real danger, and we got to figure it out now. And again, all of that was on the premise that like the absolute moonshot best case scenario, whatever your idea of it was, which, so far I don't think that's really working out for anybody. I don't think we're looking at a kind of moonshot best case scenario. So yeah, we got to focus more and more on, what can we do to protect ourselves? And what we've narrowed, the pandemic happened, and that gave us a bunch to chew on much more immediately. Like, what does that mean? Like, what kind of exposure do we have? What if I have to be treated in a field hospital at the local sports arena, was a question we got from a listener in the very early days. Like, who says they're going to take my insurance? Like, what the heck is going on? So, raised all kinds of questions. We've come back to really focusing on this stuff, and it's interesting. I mean, it turns out we have as what I'll call consumers, although we're not in a traditional consumer relationship with, it's kind of a your money or your life situation with healthcare providers, it feels like. But we have legal rights that I don't think most of us are completely aware of, and that also we don't always have a lot of ways to enforce, because it's not like if you could hire a lawyer to fight this medical bill, you could pay the medical bill. So, but we've been finding a bunch of interesting places, like hacks, like bits of wiggle room that we do have and that we can learn more about. And that I find super interesting. So, and encouraging. And it's like, oh man, like, good. The show can be more entertaining and empowering and useful than enraging and terrifying and depressing. So
absolutely.
That's kind of where that's where we've kind of taken things recently.
I really did mean in the opening, it's actionable, right? You had a great episode, I think, on nonprofit hospitals, right? Mm-hmm. And what they are legally required to do if people are struggling. And we work with a ton of nonprofit facilities within the healthcare space, and they're always, sometimes, I should say, sometimes, they are overwhelmed, just like every healthcare system, but they are almost always willing to engage with patients once they know the full story, but it amazes me as how many patients, my parents, any person perhaps raised at a generation where you don't question the doctor, right? Sometimes in today's world, you have to question the bill, you have to question the treatment. We spend so much on healthcare that it begs the question, it's this way in Congress all the time, how much of that is being wasted, or how much of it is something that the patient themselves may not necessarily need? Do you need to get your shoulder replaced, or is it maybe just a rotator cuff, or is it just physical therapy, right? And you'd be right as rain and moving back on. But if perhaps if you go to a surgeon and they tell you you need surgery, you just take it for, as gospel. I mean, in the stories and the experts that you talk to, are you seeing a shift in more educated patients and their willingness to stand up for their rights?
I don't think it's a wave, right? I mean, I think we're, as you said, like most of us are we're in a situation when we get a bill, we get a medical bill of like, what am I going to do about this? And to your point of like, well, nonprofit hospitals will want to work with people who have financial need. I mean, there appears to be a very wide range. So one thing I learned, in reporting that story about charity care is that there are a bunch of hospitals that actually like, they're on the lookout for people who might need financial aid because they'd prefer to like, if they know coming right up that like you're not going to be able to pay this bill, then they can save themselves a lot of labor in trying to chase you for it, and save you some trouble, which I think nice of them. And they can earn some community goodwill. They might be able to qualify for certain extra federal reimbursements by doing more than their share of charity care. So they have incentives to do it. But, there are hospitals that do that, and there are hospitals that totally don't, right? That hide the ball. There was one hospital I learned about that was sued by their state attorney general for really withholding charity care that they were obligated to, provide some form of. So they trained the people at reception and billing that if a patient were to ask you for a charity care application, you come back with, what, we need to talk about what you could pay.
Wow.
We need to talk about setting you up on a payment plan. And they were trained to do that 3 times before essentially acknowledging the request if you were to bring it up a 4th time. And then the application itself was so complex that one patient described it as like a book. And she remembered a question of like, what's the make and model of your car? Which suggested to her that she was like, am I supposed to sell my car to pay the medical bill here? It's, and there are, I've certainly seen, because other reporters have uncovered it, a significant number of hospitals that just chase patients as far as you can imagine to the point of suing people and garnishing their wages, which are often not very much, and putting liens on their houses. So, yeah, I mean, this kind of thinking of ourselves as being in this adversarial relationship, this adversarial financial relationship with a healthcare provider, it's uncomfortable for good reason, right? You want to be in partnership with your doctor. Yep. And I hear from doctors all the time, including some who are complaining about, like, when I'm the patient, I'm in this position too. And some of them are like, I happen to know that, like, I'm kind of reluctant to call the doc on the other side to get this straightened out because I know that they're probably just trying to get dinner with their family and they already are, like, way stacked up. Like, it's a mess. It's a mess. When you talk about waste, I mean, one thing, there was an economist who did a study for the Bernie Sanders campaign a couple of years ago. And one of the questions that he looked at was like, he said, I want to be intellectually honest here. So if we were to look at, what if we had Medicare for all, like, what would be some of the downsides? And one of the downsides is like, well, about 1.2 million people would lose their jobs per his estimate, because that's the number of people he estimated are employed on the one hand in the offices of healthcare providers, arguing with insurance companies about who should pay what, and their counterparts working for insurance companies arguing the same thing. And I looked up, like, well, how does that compare? Like, that seems like a big number. I was like, how does that compare to the number of jobs that we, think we saved by bailing out the U.S. auto industry? And the answer is, it's more, like, significantly more jobs. So that's, which isn't to say that, like, we should run our healthcare system like it's, an employment program.
Right.
We should aim to find other things for those people to do. And I've talked to people who have those jobs who are like, you know, you got to have a job. I don't love doing this. So, you know, it's a problem. You know, I think the idea that you've raised that like people overuse medical services is something we hear a fair amount of, but I don't think that's so commonplace. You know, given the number of people, certainly there's large swaths of the population who are like, would never consider doing anything like that because I can't, you know, how would I possibly afford the share of the bill that's going to come to me?
Yeah, that's a great point.
Yeah.
It's a great point. And I think, you know, with our clients, you often, you know, frequent flyers to the ED, unmanaged healthcare conditions, but, you know, an ED visit somehow will get written off, but they can't get their prescriptions up front. You know, that's one class. You have the other class that, you know, just won't take care of themselves, perhaps, you know, and, you know, and it does, what do I want to say? It overweights, you know, the healthcare system with that. And I can't remember the exact numbers, but that high top of the percentage of spend goes to the least percentage of people.
Well, yeah, I mean, I think when you raise that of like people showing up at the emergency room because that's the only place they know they can show up, and not be turned away. You know, I think about or people who don't take care of themselves. You know, I think about you know who this guy Paul Farmer is.
I don't.
He's a doctor who created a group called Partners in Health, and he's profiled in this really incredible book called Mountains Beyond Mountains that I read a long time ago. He started a clinic in Haiti, and he's since created clinics elsewhere. And he when he did his MD, he also did a degree in medical anthropology, did a PhD. And his take was like, look, you know, the costs, even, you know, clinics in Haiti were low cost compared to anything you see in the United States, but people are really, really poor. And that if you run your clinic and you're like, well, people have to come here and get the prescription, and they have to do what we tell them, and they have to pay this nominal amount. Like all those things compared to what people's resources are really, really high cost, right? Like taking a day away from subsistence labor to get to the clinic is a really high cost proposition. Taking this medicine that puts you out of commission from doing 16 hours a day of sustenance labor is a really high cost proposition. And right. Dealing with somebody who treats you as less than a human being, you know, doesn't incline you to make the necessary sacrifices to do those things. And he was like, look, you know, if we take seriously that our job is to be a healer, we gotta come to people where they are. We can't allow ourselves to sit up in our tower and make it a high cost proposition for people to get into partnership with us. Yep. And, you know, I'm super influenced by that. And he, you know, he's like, look, you know, you're gonna, the consequence of not making that effort is what we have, right? Where people don't neglect their health on purpose. Nobody wants to be unhealthy.
Right.
You know, people see the barriers to participating to finding somebody who's going to be their partner, and it's not manageable. It's not conceivable. I mean, people would love to follow all their doctor's orders. Everyone would love to send their kids to the fanciest private school, but like, guess what? You know, It's like it's not like it turns out that not everybody can.
Yeah.
The costs, you know, that people have to look at, you know, maybe, I mean, not me, but, you know, probably a lot of people would like to drive the best car in the world. Like people, you know, the healthcare, you know, not all of healthcare is, you know, is different from all those things. It's not a consumer good, but, you know, the cost of accessing real care is really high, especially because, you know, there's just issues with quality.
Yep.
I mean, that is what I would say. You know, like you go see somebody and like, you gotta figure out, is this person somebody who's really going to work with me? I mean, you know, doctors talk all the time. Nurses talk all the time, you know, about that care isn't patient centered.
Yep.
And that's a cost that imposes costs. So,
well,
yeah, I mean, that's my spiel. I know you're the expert.
No, yeah, and amen, right? Preach it, brother. Yeah. I think it's fascinating to me to pick up on what you just talked about, right? So you're, you know, manual labor how much is it actually going to, the risk reward calculation that immediately and almost instantaneously goes on in a person's head when they're living in that situation. We see it sometimes in rural areas where, perhaps there's limited access to care. They work out on a ranch or a farm. The nearest clinic is 25 miles away. Are they going to take off and go in, during the quote unquote normal business hours, when they could get a normal visit? No, they've got things to do, right? And perhaps they don't have insurance that would pay them, to take a day off, sick time, because it's a cash-based economy. Or you have people who live in an inner city. I worked in Kansas City at the zoo one time, a long time ago in the past, and probably I would say a third of the workforce took the bus. So if you get sick at work, and you need to go to the doctor, that you have to pull up the bus schedule and take a look and see where you're going. And these are sometimes the things that I wonder as we sit back and we talk about healthcare policy and we talk about improving care. What's been very rewarding, I think, to see is over time, the social determinants of health, which, we always talk about that as a major driver. But for people who truly understand it, it goes so much beyond perhaps the type of food that they eat. Not that that's not important, but it's where they live. It's how they can access caregivers. It's where is that copay going to come from? And the stress that, just wraps all of that up with an unfortunate bow, right? And how that stress will then exasperate a condition that they have. I'm kind of curious if on your podcast, it's always underlying, right? The stress of not being able to meet whatever it requires to get healthcare. Have you had episodes in which you've talked specifically about managing that stress?
Well, one thing that I think about when you say that are people with type 1 diabetes, which having now, had occasion to meet and talk with folks about their journey, mostly around I've met, essentially the people I've met have been people who are kind of like superheroes of, I met them because they have hacks. They've worked out kind of miraculous sounding hacks to be able to access care even when they don't have a lot of money. Mm-hmm. They'll access, be able to take care of them even when they don't have a lot of money. But having type 1 diabetes is, the thing we hear about and think about mostly is insulin is just so incredibly expensive unless you have the right kind of insurance, and have which includes having insurance that kind of where the deductibles and other kind of out of pocket stuff, is a reasonable match for your actual income. There's that, but I was talking last week with a woman who's like, yeah, so I'm in this job, I have the insurance and I save, but I also I never go on vacation. I never, I'm decorated. She's 50 some years old. I'm decorated in early college because she's like, I got to see the doc. I have 12 doctor visits a quarter. And, she manages everything that she's devoted considerable time to actually learning as part of a community of people to hack the continuous glucose monitors and automatic insulin pumps to make them perform better, right? Because her condition requires her to essentially be a research scientist and a computer scientist and a technologist, and that's just that's just managing the levels of insulin and glucose in her blood, day to day, hour to hour. But there's all kinds of complications that become part of your life, because diabetes is hard on your body.
Yep.
So, yeah, you not exactly. You asked me what are people are up against it? Are people fine? Yeah, people are. It's tough, but people are resourceful. People are resilient, and the system that we have is just not. A colleague of mine, Daisy Rosario, says, likes to say, we don't have a system. It's just a bunch of stuff that we do. And I think that's true.
Yeah.
And the thing that I've, come to think about a lot is that, people respond to incentives. And that the incentives that, when you talk about the millions of people who work in this system have, it's built to create incentives it's not built to create incentives for people to do the right thing. We would not have, an opioid epidemic if our incentives were correctly aligned.
Yep.
So I mean, my impression of what the actor that you work with, that you're aiming to kind of create at least more outfits that are able to correctly align incentives.
That's correct. Yeah.
So,
And,
great. Like, I hope, like, I wish all the success to you in that endeavor. And I imagine, like, I should listen to your podcast. I imagine it's an uphill battle because, again, our non-system, seems to me like it is just filled with misaligned incentives. If our objective is like more people in better health and less misery.
right. People taking control of their healthcare is a common phrase, that you'll hear a lot of, but you have to be educated, right? You have to know what perhaps you don't even know, and you have to be educated to know how to express that. And I think working within my own family, working with clients who are definitely learning new ways to engage patients in their care, whether or not it's through technology or perhaps for the 89-year-olds who don't want to embody technology, through just a telephone call, right? That it gets back down to the person-centric practice of medicine. And I think we are starting to see a shift for those early adopters, right? You'll always have those people who have waited for this opportunity to change their system, to get rid of some of this, what seem to be misaligned incentives, and to do the right thing because that is where their heart is. And then, like you previously mentioned, that healthcare system that was purposely doing the wrong thing. We have to highlight and expose those groups, and we have to then, show that they are they're the dinosaur that is going away. And it's going to take a while. I mean, everybody knows it didn't get this way overnight. It's not going to change overnight. But, you had touched on briefly, and I think I know we're probably going to be coming to the end of our time here. But, as we look at this, there has to be bright spots along the way. I can, think of a number of our clients, their population health nurses, for instance, who once they implemented team-based care to do the right thing, right, spend more time with their patients, they start sharing stories that can just, melt your heart and remind us why healthcare truly is a very personal thing that can inspire us if it's done correctly. Do you have any stories, that have just stood out to you over your years of doing this that are like, what, we are broken, but we're getting better?
Huh. Well, I don't know. I mean, the stories that I know of are just, I don't know that I could ever, I mean, we're talking about a sixth of our economy, right? $3.8 trillion. There's no one story about any of that.
Yeah.
But it's my job really to look for like where's the wiggle room? Where's the hope? What can we do more of? And the good news is there's just so much of it. And, the folks, we're re-releasing, as I talk with you, an episode I did very early on about insulin and how it came to be discovered and how it came to be so expensive and what people are doing about it. And I reconnected with some of the people I talked with for that episode, people who are type 1 diabetics who are pursuing projects. And it's and in a year and a half, people have come a long way, and it's kind of awesome. So this woman who has this like open source rig to control her glucose monitor and her insulin pump. She said she used to spend a lot of time. She said she spent years learning the coding required to make that stuff work. And there was a community of people there to help her. And she, made time when I was talking to her to give back, to help other people learn to use this equipment. And she said in the last year and a half, like, she hasn't been spending as much time doing that because this stuff has gotten so much easier to use. Like, it's working. And
yeah.
so, and it's also gotten more sophisticated so that she now, instead of having this thing that she built herself, in a little eyeglass case, it looks like a raw motherboard with an antenna on it. She now has this little thing in a case that, some guy makes and kind of sells at a very reasonable cost, that does the job, that kind of helps everything communicate. Instead of having to be logged onto her computer, she manages it all through a smartphone app. There's more automation in it. And so she says, like, the upshot is, she's like, I think about diabetes a lot less than I used to every day.
How much less stress would that be?
I mean, it's great. It's great. Yeah. Another person I talked to was part of a group that is trying to create an open source recipe for insulin. And they actually have made pretty interesting progress, and it's essentially a volunteer effort. And they have been working from like biohacker maker spaces, and they have a grant from the city of Baltimore to kind of start implementing some of their vision. They've been, one of the things that came up, in my reporting was people were like, well, good luck getting the FDA and the DEA to let you, distribute any of that. And they're talking with regulators and legislators about finding ways and figuring out how to steer their project in directions that would allow them to actually, distribute this community-made insulin. And, he has the kind of project founder, said to me, I think we're a few years and a few $1 million away from being able to do this. He's like, that's comparable to like putting in a new stretch of road in a small town.
Wow. Yeah.
Yeah. Right. I mean, that's amazing.
Well, they say what necessity is the mother of invention, and what a sad testament, but a great testament to their ingenuity, but a sad testament that we've gotten to that point in American healthcare where you have to hack insulin to make it affordable.
It's
right.
Especially given that the scientists who discovered it were very explicit that they did not want anybody making a profit off it.
Wow.
So,
well, kudos to her. Kudos to that community. I mean, it is by their grace and efforts that, perhaps my child's children will be, who need insulin will be getting it without any cost, or, something that's.
Do you have grandkids who need insulin?
No. I mean, my son right now is 11, so hopefully he lives a happy, healthy life. He does have, though, one of his best friends actually in school is child diabetes, and juvenile diabetes, and has the insulin pump automated and things like that. And I couldn't imagine being a parent who has to worry about cost, about that technology failing, things like that, right? And once again, that goes to the stress, which contributes to this condition. And, I am optimistic that the industry is trying to find better ways to do it, even if it is the patients, like you just said, that are leading that charge.
Yeah, people are resilient. I mean, can I tell you one more story?
Sure.
Yeah. So our most recent episode, as we talked, you talked about it as an episode about nonprofit hospitals. I think it's an episode about, I think it's a story about, local ingenuity, kind of finding a way and finding these spaces, finding this wiggle room. Because that story is really, to me, like, this guy became kind of social media famous overnight. He posted a TikTok video that said, like, hey, here's something you might not know. If you make under a certain amount of money, you should be able to get your hospital bill written off. Here's how. And he kind of showed you in a 60-second video how to, find the financial assistance policy for your hospital, to kind of, hit Control F to kind of find the place in the document where it would say what the income cutoffs were, and that you could then go apply. And he's been doing this for years for people locally where he lives in Portland, Oregon. And he kind of backed into it. He thought he was starting a little thing. It was kind of before GoFundMe was a big thing. He thought he was starting a little thing to kind of collect money to help somebody's health care bill every month. Kind of collect $1 or $2 from a bunch of people and be able to help somebody every month. And, eventually he incorporated his nonprofit, and a guy joined his board who was a lawyer, who was like, hey, I found this thing that I don't think enough people know about, which is nonprofit hospitals are legally required to have charity care policies, and you can, make them live up to it, but you've got to know. And Jared, the founder, was like, really? And had to be convinced, had to be shown. And then it was like, well, I'm changing the model of this organization right away. And They've been doing this successfully, in Portland for a couple years now, and almost by accident made a TikTok video, almost kind of on a whim. It was like, well, my younger sister, or my young niece is like, you got to get on TikTok. So he made a TikTok, and it's been viewed more than 10 million times, and they're just deluged with thousands and thousands of people saying, hey, some of them saying like, I did this, it worked, thank you, and others saying, because he offered, can you help me make this application? And they are just grinding their way through these applications. It's the number of, there are some hospitals that hide the ball deliberately. There are some people who just have no idea that the hospital would want to help them. There are hospitals where I'm sure they're just bureaucratic. reasons that they haven't been proactive about offering this. But there's evidence that there's billions and billions of dollars every year of charity care that does not get dispensed to people who could use it. And, if a 60-second internet video and, a little follow-up can unlock that, I mean, again, like $3.8 trillion is a lot more than billions and billions.
Yeah.
But like billions and billions sounds pretty good. That's a good start. Yeah.
Let's not, what do they say? Throw the baby out with the bathwater. I'll take a few billion off the cost of healthcare this year, and we'll just build on that every year after. Well, Dan, it has been an absolute pleasure having you here on Healthcare by the Numbers. Are there any final thoughts, any pearls of wisdom or comments you want to leave our audience with?
I have taken up so much of your time. Thank you so much for having me. Yeah, I think this is having now done. I was worried before I started that it would be too depressing to do a show on this topic, and so far, no.
you don't have the bottle of bourbon and blues going right now.
No. I mean, there's just so many people doing so many, inventive, purposeful, smart things. And we all like, and I'm just so personally, I'm just like, great for me. I get to spend my time learning about this and sharing what I'm learning, and I hope. I hope it's useful to lots of people, because it's really encouraging to me what I get.
Well, I think it is evidenced by, people continuing to come back to your shows and express on, your website and on Twitter and others, how much, what they've learned and what they've been able to use in their own life. And I think at Caravan Health, right, one of the things we focus on the health systems, and finding stories that help patients are, at the end of the day, what drives us. Back when I was a regional vice president and was in charge of my own territory here, I got to meet with all the population health nurses. And some days you sit there and wonder to yourself, these are great changes, right? We are trying to realign the incentives, but is it really having an impact to the people that it matters the most, the patients? And then you sit down with a population health nurse who talks about, cranky Joe, who refused to do anything about their health, and they were very bitter. And then a population health nurse took the time to get to know him and found the reason that would make cranky Joe move, which was going to visit a grandkid that they hadn't been able to visit, got him to lose weight, got their type 1 diabetes well under control. And about 6 months later, got a picture from Cranky Joe that showed him with his grandkids, right? And those are those are the stories that tell you that we can do this, right? And not only on the patient level, but also at the system level. We incentivize that level of care, and we're going to make a real difference in people's lives.
A little bit, man. There's a lot that's right in front of us to do. That's for sure.
Absolutely. Well, again, Dan, really enjoyed our time. Thank you so much for joining us today. For our audience, if you'd like to learn more about Dan and his ongoing work, you can check out armandalegshow.com or Twitter at armandalegshow. Dan's Twitter is also at Dan Weissman, which is WEISSMANN. And for everyone listening, I want to thank you. I'm Todd Searls for Caravan Health, and this is Healthcare by the Numbers. Until next time, take care.